各位观众，大家下午好，今天是周四，上次说是3点钟左右，经过昨天来的邮件临时通知说是今天1点钟开始，可能他们每周四现在都可能有一些新的变化，所以我们也实时的调整到1点钟给大家做现场直播。从最近这一个礼拜来看呢，每天的新增大约都是700-800个，昨天也是700多还是800多。我翻一翻昨天是礼拜一我们给大家做简报的时候呢是3天是上周5、6是上周5到6是881， 6到日是847，日到一是763。后来呢也是书面的通知，也是700-800，我印象里边。那么这个我看看的，昨天的是841昨天是841，那么总数呢就到了127889个了。住院呢是515个，这个是显著增加。我们礼拜一给大家报告的时候，住院是484个。重症监护呢是158个，那昨天给大家报告呢是171个在重症监护了。那昨天呢还是报告有新增5例死亡，所以这个还是比较可怕的。那大家都可以看到印度的这个惨况很多都是因为没有氧气，所以各国包括美国政府，包括欧盟包括大陆我们中国大国说也是给他们人道主义援助但是呢又指责这个货运不配合等等等等，我们就不管了。反正呢全世界都是在提供人道主义援助，因为这个病呢主要是吸氧气，如果氧气够的话呢，那就可以足够的维持。那也有人说这个病毒就像今后的流感一样，每年会有变化，那么每年可能要打流感。那主要呢，如果这个病毒就像流感病毒一样呢，死亡率控制很低很低，同时呢住院率很低很低的话呢，那就不是很可怕了。那今天又得到消息说大陆又有印度变异体。
Good afternoon, my name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Thursday, April the 29th.
今天是4月29号
We're honored to be here on the territory of the Wakangan-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Friday, we'll be providing a COVID-19 written briefing at 3 o'clock, approximately 3 o'clock, with case counts and other relevant information about the COVID-19 pandemic in BC. Dr. Henry and I will be in Vancouver on Monday.
礼拜一呢，他们两个会回到温哥华也是3点钟左右做新闻简报现在请我们的首席医官。
Thank you and good afternoon.
大家下午好。
So for today, we don't have all of the numbers
今天的
in
数字
yet,
不
but
完全
the
大约
overall totals are in. So we do have 874 new people who've been diagnosed with COVID-19 in British Columbia, bringing our total to 128,763 people who've been diagnosed with COVID-19. That includes 187 people in the Vancouver Coastal Health Region, 574 people in the Fraser Health Region, 29 people who live in Vancouver Island Health, 60 people in Interior Health, and 24 people in the Northern Health Region. We don't have the active cases and some of the people under public health monitoring at the moment, but those will be updated on the BC CDC dashboard this afternoon. Of the cases that we have in BC, 503 people are in hospital right now with COVID-19, 178 of whom are in critical care or ICU.
下降一个 ICU 170个。
We have 7 active outbreaks in long-term care, assisted living, or independent living, and 6 in acute care.
一个是
We've had
长期护理院
an
6个是
additional 1 death, one person who's died from COVID-19
有一
in
例
the
死
last
亡
24 hours in the interior health region,
在内陆
bringing the total number of people in British Columbia who've died from COVID-19 to 1,577. Our condolences go again to all of the people who have lost loved ones. to their family members, to their care providers. Our thoughts are with you during these difficult times. To date, we've delivered 1,749,375 doses of all three of the COVID-19 vaccines in British Columbia. Of those 90,296 are second doses.
有
Starting
9万多已经
next week as well,
第二
we
季
expect to receive
那么下个周呢
the
我们会有
Johnson
更多的
Johnson
强生疫苗会来
which is a single dose viral
这个只要
vector
一针就可以了
vaccine.
打一针就可以了
As I've mentioned, we'll be integrating this into
他
our
说我已经提
immunization
出过我
program.
们会
And currently
因为
we
这
are
个因为
finalizing
强
the
生疫苗
plans
只要
for
一
that,
剂
and we'll
所以呢
share
我们要
that
修改我们的
information
疫苗接种计
with
划
you, early next
可能要
week.
加强更多的
In the meantime,
这个人
we are
会
continuing
更
with
快
the
的接到
mainstay of our program
所以
here
现
in
在
British
更多的
Columbia,
人
which
还
is
是
the
在按照原计划走
age-based
还是按照年龄分
And
布
that
来
includes,
接种
going down in increments
那么现在呢
by
年龄呢
age
慢慢
because we
往下
know
走
that even the age difference between 40 and 50
就算是
increases your
40
risk
不
of
同的
having more
50
severe
不同的
illness or hospitalization
现在看来
with
这些年龄阶段的人
COVID-19.
住院的人也是
Unfortunately,
显
in
著
some of
增
our
加
communities in
所以
British
这个
Columbia.
我们的
In
社区
addition, we've
这一部分人的人
identified
群
over
感染率很
200,000
高
people who have conditions that put them at a risk that's
所以
commensurate
我们
with
现
an
在也有
age
条
that
件
is
让他
higher
们
than theirs.
却在置于
And
高
that's
风
our
险当中
clinically
所以我们也要给他们
extremely
慢慢施打
vulnerable program. And that, again, has identified over, I believe it's 70% of people who received a letter have now received their vaccine.
所以现在是基本上 70% 的人注册的人 70% 的人已经
It's important to know as
开
well
始
that
是
we
接到
have
他们
had
预约通知
our
可以去打疫苗
priority worker program that was a little bit waylaid because of the concerns and
那
the
么同时
issues
呢
we
我
had
们
with
对
the
那些
AstraZeneca program. But that has
那个
continued,
工作场所施打疫苗的
particularly for
这个计划呢
first
可能要
responders,
延迟一
for
点
school
因为就是
staff, and for
阿斯利康
childcare
疫苗的
And
这
it's
个
about 15% of
这
the
个
overall
副
vaccine
作
that
用
we
的
had
担
in the
心
last
所以
few
呢可
weeks.
能还会
And as
晚一
you
点
know,
推
the
出
amount
和
of vaccine
最
that
终
we've
完
had
善
in the last
对
few
工
weeks
作
has
场
been
所的
constrained,
施打的疫
which
苗
has
的
meant
计划
that we've been able to do that by high-risk communities.
所以
and
我们
it's
呢
been
也要调整
prioritized
是对
around
这
the
个高风险
province.
的社区重点施打
Right now,
就是热点
registration is
地
the
区
most efficient way
那么我们
to
现在
get
看来
registered and
只
to
有
get your
注册了
vaccine
之后
in our programs,
才能使
the
大家
age-based
更
program
快速
and
的
the worker
有效的
program.
去接种所以希望大家还是要注意这个去注册注册的话呢使得我们在这个后台管理方面呢可以无缝的链接那么同时呢我们有效的管理大家来预约那个接种同时我们也会给大家保证你可能一定会得到疫苗该得疫苗还是得疫苗
where people are registered and where
同时呢对我们管理上来讲也可以知道哪些人在哪里打疫苗哪些人在哪里疫苗
That's because we have a lot of capacity
那么我们现在已经慢慢容量了已经开始扩大我们已经有能力把更多的这个疫苗分发到各个诊所以及药房所以这个都是让你能够及时的方便的获得疫苗
And it has been slow But the good news is that we will be receiving
那么现在呢辉瑞疫苗一开始有一些耽搁但是呢好消息是接下来的几个礼拜辉瑞疫苗会增加更多的量到货量所以我们的速度会更快那么在接下来一个月里边我们会预计100万支疫苗会来
In addition, our worker
那么
program
从
will
这
be
个
able
数
to
字
be
来看现在是
accelerated as well.
174万
15%
那么就算
means a much
接下来一个月
higher
辉瑞是
volume
100万的话
of
也就是
vaccine that we'll be able to
274万
provide people
总数呢
in
是
the coming
420万
weeks. So this is the good news.
那么
And
他也
this
说这
is
个是
what
好
we
消
have
息
to look forward to
5月
in
份
the
可能
coming
会
weeks.
增加会比计划或者是比4月份会增加 15% 的接种量也是这样的话呢让每一个人基本上有机会有条件能够接到同时呢争取到6月中旬大家都能打到第一针现在变成6月中旬了是的确是快了本来是说6月底
we have been doing targeted clinics in certain areas doing outreach clinics and as we saw this week in Fraser Health trying some new and innovative ways to try
所以他也是说呢，我们也是看更多的方法来鼓励大家来打疫苗，看看我们有哪些更好的办法，让大家能够轻易的方便的来找我们施打疫苗那么现在好消息呢，绝大部分人还是愿意来接受疫苗，因为事实证明疫苗对人类来讲现在是最有效的防疫方法所以现在呢，看来热点社区也是要给他们先打，因为他们至于高风险，同时呢高风险的地区的这个阳性率会很高，所以我们也要调整策略，把这些疫苗也要部署到这些热点的社区去同时大家也知道人们会传染这个新冠疫的病毒，所以我们如果在这个长距离的旅行的话，一定会把病毒带来带去，所以我们希望大家就地所以我们现在呢已经划布了本省划布了3个大区那么一开始是说每个卫生区不能管辖比如说沿岸就沿岸但是呢后来呢是调整了，就是沿岸卫生局和飞沙卫生局相互之间可以走，也就是说我在 Burnaby 的人我也可以到这个温哥华去了，那温哥华的人北温的人也可以到高桂林去了所以他说我们也看到了本省的到处在传播我们现在低陆平原大家可以看到了是一个很高的传播水平，所以希望大家特别是在飞沙沿岸2个地区，我请你们一定要这个注意防范一定要注意所以希望然后呢那个医院呢我们也是不要让医院呢有更多的负担，所以呢医疗资源不要被击垮，所以我请求你们能够给我们支持资源，那么同时呢也帮助我们遵守这个我们本省的旅行禁令我们也是，那么他也提到了什么Sunshine Code 这些地区这些热点地区，我请求你们不要再去了，给那些社区不要去带来更多的风险带过去他们所以在这的那个5月份的长周末希望我们能让他们保持安全我们不要把这些威斯了我们不要再把病毒带来带去了所以对他们来讲也是很挑战很困难的，那么所以呢希望大家还是远离我也请求大家继续注意那个我们的原来的措施我们每天看到新增的几百例措施，所以我们也看到了很多现在的过去的几天里边医疗的这个水平这么高住院的这个资源被占用，所以这个是特别是这个重症监护所以这个一定要希望我们引起格外的重视阻止病毒的传播，请大家相互帮助。
And I know most people are doing their very best, and for that,
所以我也知道大家都绝大部分人都是竭尽了自己的努力我们也很感激大家所付出的艰辛的努力。那么同时呢，也有些人呢很容易得到愤怒因为这个什么还没有结束你们怎么所以我们希望每个人都点点滴滴的努力建立起我们的这个防护的防线。
But we need to hold steady in our efforts.
所以我们也是希望能够团结一起一起这个 hold the line 就是建立起这个防线同时呢layers of protection 就是多一层防护措施，所以也是能够如果轮到你去打疫苗了，那就去打疫苗。那么在接下来几个礼拜大家都能会打到了，所以你的容忍你的宽容这个是使得我们每一天都能够战胜，所以我们每一天一天一天都在进步。我们马上要到5月份了我们马上就要接近疫苗这个我们也是要始终记住我们一定要安全容让以及安心这个也是当下相互stay small不要人员聚集。那么卫生厅长呢也是做一个
offering my condolences to the families, friends, and caregivers of one person who's passed away in the last 24 hours from COVID-19 in British Columbia.
这个是内陆地区的，刚才博尼医生说内陆地区的啊。那么现在呢，我再给大家报告一下，数字不全，他说大多数数字已经出来了。昨天到今天为止新增了874例，那累计呢是到了128763例了。那其中呢，沿岸是187例，飞沙卫生局是574例，岛上卫生局是29例，内陆卫生局是60例，北部卫生局是24例。那么住院呢是503例，其中呢重症监护是170例，就是这样。那么到目前为止呢，已经有1749375个人打过疫苗了，超过9万多个人已经打了第2针了。
All 138,060 doses. The remainder that we're receiving this week of Pfizer vaccine that it arrived. The final vaccine arrived yesterday. So that means that as of the end of the day, yesterday, we received 302,990 doses of Pfizer vaccine. And we've administered 1,189,756 of those doses. Obviously,
那博尼医生刚才也说了，在接下来的1个月里边呢，还会收到100万剂的辉瑞还会到达。那么所以呢，现在计划是到6月中旬预计全省的能够打疫苗的人都能够打上了本来是6月底最早的时候是9月初因为这个9月初呢是根据打2针的这个计划，那现在都是打1针了不是说只打1针，也就是说先让每个人打1针，那同时呢第2针的人再慢慢跟进，因为他们也是在说不断的在这个调整，因为他们打过疫苗的人呢，他们一定在监测体内的抗体水平。
338 doses of vaccine. I wanted to note that our clinically vulnerable effort, and from March 29th onward, people who are clinically extremely vulnerable
他说从3月29号以后呢，那些特别虚弱的人都是开始给他们打了因为都有医生证明了他们先打的那么也是现在呢已经有很因为这些人该打的都打了，因为这些呢都是诊所开证明的，说他们是特别虚弱的，要让他们先建立起疫苗的防护的。
Very appreciative.
所以他也说感谢这个我们的麦当劳这个医生领导的团队。
I wanted to also say finally
that
if you have not registered for vaccine,
那么请大家如果你还没有注册，50岁以上的人还没去注册的话，请你们赶快来注册那注册完之后呢，我们尽快会给你通知你来预约。今天呢是63年以后生的人都可以来注册了。63年以后的人都可以说错了，都可以来预约了。因为注册呢，18岁以上的人现在都可以去注册了
And you are any age in BC above
那么他也是说到了，只要18岁以上的都可以了请你们赶紧来注册。刚才博尼医生也说了，注册是一个最好的管理以及部署疫苗的方法，所以请大家先去注册他卫生厅长说了3遍注册。那么同也是说到了我们的这个这个现在呢是有9个医院呢是做这个。有些9个医院是做非紧急的手术呢，都往后拖了非急诊的在内陆低陆平原有9所医院不做了等等。现在就是说这个措施也是去年这个时候开始的，也就是择期开刀这些非紧急的开刀，什么换关节啦怎么换这个膝关节还有这些其他的非紧急的手术呢，该拖就拖了。
The same day. I just so with respect to the shift that began April 26th, that change in the way that we deliver surgeries and the postponement of non-urgent scheduled surgeries in Fraser and Vancouver Coastal Health. but a number of postponements were made prior to that as health authorities readied themselves. Today we can report the number of surgeries postponed from April 19th to April 25th was 398. It's 198 in Fraser Health, 197 in Vancouver Coastal Health, and 12 in Vancouver Island Health. It's important to note that no surgeries were postponed in Interior Health, Northern Health, or the Provincial Health Services Authority. Just want to report that for the week April 12th to April 18th, this is the week before last, health authorities completed 7,045 surgeries in total, of which 5,532 were scheduled surgeries and 1,513 were unscheduled surgeries. By health authority, that's 1,799 in Fraser Health, 1,285 in Interior Health, 418 in Northern Health, 1,735 in Vancouver Coastal Health, 1,488 in Vancouver Island Health, and 320 in the Provincial Health Services Authority. As this report and last week's report have made clear, this is a particularly challenging time in our COVID-19 fight, with pressures on healthcare staff and hospitals that we have not seen to this point of the pandemic. If we are among the 38.6% of British Columbians who have had our first shot, or if we'll soon get our first shot, and as good as we should feel about either, I would hope that these two surgery reports would help keep us focused, all of us, on those who care for us in our hospitals, those in hospital who need care, and those in need of surgery who have seen COVID-19 delay the surgery they had scheduled. Each of them, whether a care provider, someone in need of care, or someone awaiting surgery, is counting on us to do all we can to stop the spread so that we can push back the COVID pressure on our healthcare system.
所以，因为他也是说到了这个新冠疫苗，这次新冠病毒这次第三波的凶猛疫情呢，为了不要让医疗资源挤垮呢，该做了一些相应的措施，也就是刚才说的择期开刀的延期啊，重新安排手术时间啊等等。所以这个也是感谢很多的这个医疗管理工作人员，他们的艰辛努力他们也有很大的压力所以也是感谢他们他们的艰辛努力是提供了我们每一个人的安全，提供给我们社区保护我们的安全。128,676 cas en Colombie-Britannique. Nous sommes attristés d'annoncer un nouveau décès lié au COVID-19 pour un total de 1,577 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 503 personnes sont actuellement hospitalisées, dont 178 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
A reminder to reporters on the line, please press *1 to enter the queue. You are limited to one question and one follow-up. First question, Richard Zussman, Global News.
I'd like to ask about hospitalizations in ICU.
那么，作为记者问的是住院情况以及重症监护的情况。
Still over 500.
那么现在已经500个人以上在住院。
Do we know if this continues to skew younger?
那么他想了解大致这些人是年纪轻的人还是年长的人那么他们能不能收到疫苗？他们能不能现在打疫苗
the last part of it I cannot tell you on an individual level whether somebody refused the vaccine or didn't sign up for the vaccine. What I can tell you is that the majority of people, and I showed this data a few weeks ago, and it continues the same. And if you look at our the BC CDC weekly surveillance report, it shows that as well. What we are seeing is people from 40 to 59 have been increasing in hospitalization, and people 50 to 79 as well. And there's always been a relatively high rate of rate, so per 100,000 in people over age 80. So additionally, still, age is the most predictive factor of ending up in hospital or ending up in ICU. What we have seen in the last week is that has started to come down again, which is good news, but we know it takes time before hospitalization and people who end up in ICU either recover or end up being transferred back to non-critical care. So that is a lag indicator, if you will. And yes, the
么好消息呢，就是说这些疫苗来了之后呢，会保护更多的人，不让住院了。重症监护他说这个呢会有一个延迟，所以现在还没看到，因为疫苗开始不是注射，都是开始部署了。那么这个呢会有一个延迟，大家会看到慢慢这个他说住院人数会下降，包括重症监护的人数会下降啊。那么同时呢，就算接种过了之后因为在身体里边还没有建立起抗体的时候呢，也会容易传染上。
I do, and I'm not sure how much of this is specifically your jurisdiction, Dr. Henry, and Minister Dix may be able to better weigh in on this. But what work is BC doing with Washington State or other jurisdictions in the United States to have cross-border vaccinations? In Manitoba, they announced today that teachers will be able to get vaccinated in North Dakota.
那么他也是说到了，可能这个问题呢，不是你们两个人能够全线管理的。他说，马尼托巴省呢一宣布，他们的老师可以到美国的蒙塔纳州去打疫苗。那么 BC 省有没有这个跨省、跨边境去打疫苗同意的这个情况？因为这个主要是让老师们先部署疫苗。那么他说，我也跟我们的同事们，包括阿拉斯加以及华盛顿州的同事，以及俄勒冈州的莫特纳的Ohio州爱达华州等等，都有联系，都有讨论也跟他们的政府、州政府、州长。同时呢，阿拉斯加的州长其实也是给我们 BC 省的居民打上个礼拜打了很多。那么华盛顿州呢，他说也有这个潜力可以给我们这些人打。特别是我们那些跨边境的那些卡车司机，我们已经跟他们讨论过了。我知道我们的省政府也跟他们州政府讨论过，但是我们现在没有启动这些程序。这个很清楚了，这个蛮有意思就是本省暂时还不承认，也是不同意，也不鼓励。至少呢，但是呢，阿拉斯加州长他伯尼身上是已经感谢他了，也就是说我们因为在北部阿拉斯加和 BC 省是交叉的，像牙齿犬齿交错的，所以呢那个阿拉斯加的州长很慷慨，也是给我们 BC 省居民去施打。
Minister Dix, I just wanted to clarify one thing you said about the surgery cancellations in Island Health.
那么这位记者是想问的是卫生厅厅长关于择期开刀的那个取消或者是延长的问题。
Because patients are being transferred here from other health authorities, and if so, if you know or can tell us how many have been transferred into Island Health from other health authorities.
那么同时呢，他想问一下有那么多有多少例？
The number 12 is for the period between April 19th and April 25th, and we'll be reporting in detail.
他说会下个礼拜四会给大家公布详细的数字，因为这个记者是想问不同的卫生局下的这个转移的病人数字，也就是说，比如说你是延安卫生局，现在因为医疗资源怕计划，那么转到其他卫生局开刀，那么这个记者想了解一下这个数字。
At the beginning of the pandemic, which is a real achievement in Island Health, but I think what you're seeing in Island Health is the ongoing significant pressure on the healthcare system, very partly related to COVID-19, because there are some cases in Island Health hospitals, but overall in the healthcare system on Vancouver Island for surgeries and everything else has been going very consistently in the last period, and in fact we've been making significant progress. So these are adjustments, and they're really hard for patients when we have to postpone a surgery or delay it for a period of time, and to the maximum possible extent we avoid that. But Island Health's situation has nothing to do with the COVID-19 situation or transfers from other health authorities.
April, do you have a follow-up?
Yeah, just a clarification further on that. Would it then be fair to assume it's because of staffing issues, or is there staff burnout, staff sick time? Is it more related to that?
这个问题也是没什么问的，也就是说你这个医疗的员工资源的负担问题，也是你这么转移来转移去这个其实跟我们关系不是很大有一位网友，谢谢你，也谢谢你对我弟兄，看来也是应该是弟兄曹弟兄，也是谢谢你我是尽量把政府的正确的信息告诉大家也有人怀疑这政府的也是在说谎，但是呢，我有这个责任把这个政府的信息报告给大家。毕竟我们在加拿大没有官方的宣传机构，没有这个强烈的这个联播的形式给每一个人强制灌输。那么我们作为这个媒体呢，也就有这个责任把一份信息告诉大家不要因为这儿也没有什么专门辟谣的一个场所或者是机构，所以我尽我所能，也求神祝福大家。
Next question, Penny Daflos, CTV.
Very much for coming to me. Dr. Henry, you called them new and innovative, but a lot of people missed work, some of whom could ill afford to do so, to wait in line for a vaccine pop-up that they heard about through social media or text rumors. So some who waited didn't even get a vaccine. They're frustrated, disappointed, confused by these unannounced
那么他为这位记者就说了，现在这么多自媒体，有些呢是谣言，有些是传说有些人觉得没有打上疫苗，有些人就是说打很长时间等到还没有打上这些都是这些负面信息或者是很沮丧的。
You know, we are concerned about the way they rolled out. These were done with the right intentions, that people were notified through means, and as you say, it got a life of its own that was not anticipated in social media in particular, and that made people do things. And you know, I do have to say, if you're not in those communities, do not go to those communities. You will get your vaccine, and there's enough vaccine coming in the next 2 months that
这个我本人也是碰到了这个情况，也就是现在有13个热点地区，那有些人呢是40几岁、30几岁都收到了打疫苗的通知，因为都注册了嘛。但有些地区呢，它不是非热点地区，他到了50几岁了，他还没打上，所以他就觉得不公平。为什么有些人能打上？是不是有这个不公平对待啊？那么这个记者也就这么，因为不是所有的人都知道有13个热点地区，至少我知道13个里边不是全部的地方我知道，但是我知道为什么有些人他年龄没到他能打上，有些人年龄到了还没打上，就是因为他在热点地区，他没在热点地区这个所以这个伯尼医生也是在解释一个这个政策。
Those are directed at those communities, and we will be working with Fraser Health as we do.
特别是菲沙，他说菲沙卫生局也是我们也是紧密配合菲沙卫生局。
Remind people the main part of our program where most of the vaccine is going, primarily based on Pfizer.
所以也是请大家一定要记住，就是说我们现在制定的疫苗计划还是让绝大多数的人去受益。也是希望大家理解，先注册是对我们这个疫苗施打来讲的管理上最方便，对你来讲也是最有效的一个办法，去获得疫苗的一个办法。他也是说他特别是在数理地区有些地方特别是很困难，特别挑战社区，所以特别是这些有宗教场所的，所以在接下来几个礼拜里边呢，也是他们这个热点地区要去打。
I'm hearing that from experts that research from the U.S. points to vaccine hesitancy among racialized communities in particular, not actually being hesitancy, but more vaccine confusion, where and how to get vaccinated. Right now in BC, we've got an official provincial website. We've had pharmacies with their own system. We've had the rumor mill and vaccine hunter Twitter accounts that have people driving all over the place for these pop-ups. The vaccine rollout comes across as both confusing and confused. So I would just like to know how you're going to rebuild public trust after this, and in particular, address vaccine confusion.
那么这个新的词叫疫苗困惑，因为他说看到了美国的同行媒体也是在调查美国整个社会，得出了一个人们对疫苗的困惑，对疫苗的这个迷雾那么我们有没有强烈的一个做法，能够让人家把你们的信息能够传达出去或者是如何正确面对这个疫苗的选择那么他也是说到了这个疫苗的选择问题，也就是说辉瑞这个莫德纳以及阿斯利康的这个，所以他也是说到阿斯利康的问题了阿斯利康因为大家都知道一开始是都可以打，后来呢又说是55岁以上打，那么现在呢又是40岁以上打，那么他说这个现在我们的最主要的一个阶段呢我们现在已经有150万以上的人都根据年龄来打，已经打了因为实际是170几万，但是150万是年龄来打，还有20几万呢就是基础工作first responder 那么下一礼拜呢他说我们还很自信的就是我们有更多的疫苗来，同时呢大家没有这个有缝隙的没有缝隙的这样能够衔接上去所以他说了我们的省的疫苗政策还是以年龄为主所以他也是说从这个最风险的人也开始去打，那么最风险大的还是年龄，同时呢也是这些基础工作人那么现在呢70岁以上的80%的70岁以上的人都已经打了
and that will be there for all of us as we go through these next few weeks and I know there's many different reasons why
所以我也知道很多的原因有些社区那个都有不同的问题，他们也有不同的原因他们为什么有些人呢上不了网因为语言的问题认知的问题理解的问题他们的问题没有得到回答，他们的困惑没有得到正确的回复
Next question, Lisa
所以
Yusta,
特别是
11:30.
对于疫苗的这个困局，所以呢这个是的确是，那么现在呢他也是说到了70岁以上现在有80%的70岁以上人已经打了疫苗了，那也就是说有20%的老人还没打
or that they work in them or they go through them and that they're feeling ripped off and they're feeling like they're getting left out with this age-based program. So I wonder if you can just talk to that panicky feeling and the anxiety a lot of people are feeling.
I know, and it's really tough right now as we see case rates being very high. We see people in hospital, and we want to do our part to be protected ourselves, and also I know to protect our families and people we're closest to. And it has been incredibly challenging to stand here and know that we only have a limited amount, and how can we get it to people in the most efficient way? But I can be reassured, the things that we need to do
就是开这个新闻简报会，我们也资源有限我们的所做的也有限这个也是，所以我们也是希望就是那个每个社区也能够把这个疫苗的好处能够宣传出去。
It didn't make sense to go in multiple times. We've had great success in a number of our high-risk industries.
所以他也是说到了我们现在在这个高风险的这些行业已经给他们打疫苗保护了那些基础工作的，比如说食品加工家禽加工所以全省的这些行业都已经打了食物加工厂等等。
It's everybody but us, but each person, each community, each
他说每一个人每一个社区每一个行业就只能是靠疫苗来保护
It is taking longer than we would like.
那么也是但是呢花了比我们预期的时间来得到了疫苗的保护但是接下来呢有更多的疫苗会来所以希望大家稍微等一等耐心一下 所以马上会来我们也马上会得到我们如果每一个人都打上疫苗的话我们还要庆祝一下我们马上 上就会几个礼拜点点滴滴都会取得最终的胜利他们一直在说 collective 点点滴滴的就是一定今天一滴明天一滴，他说几个礼拜以后一定会达到这个每一个人都能打上疫苗的这个打上疫苗了这个一点。
That's what we will be able to do once we get everybody in the registration, because then we know the exact numbers.
我也希望每一个人都能够注册上有些人还没能注册我知道就有些人没有注册他不愿意打这个我是知道的所以就像我认识的不多都有人不愿意注册不愿意去打疫苗那作为他的首席医官他一定知道整个 BC 省一定有一部分人不愿意打
And the best thing that we can do to make that easier and be able to forecast a little better is for people to be registered.
所以他也是说到了为了更好的让我们做疫苗的部署计划最好的办法还是请大家先注册注册了之后我们才知道那个有多少人来打我们才能够做更好的预测计划疫苗的计划以及让我们把这个疫苗部署更科学化所以我们一直在尝试在做我们也不希望能够取消你们该打的我们来主动来取消你们这个预约等等我们不愿意这么去做所以我们也希望能够把我们手上的疫苗越早快发出去越快速发出去越好
where we will have enough vaccine to really accelerate those clinics.
那么接下来礼拜一呢开始呢因为我们会有足够的疫苗特别是这个辉瑞会加强供货希望大家呢能够朋友告诉朋友大家告诉大家
with the vaccination registration
所以希望还是请大家注册先注册因为英文里边 vaccination registration 有点搞了就是所以希望大家还是来注册注册那么接下来的几个礼拜的疫苗供货会加快所以呢我们的步伐会更大一点更快一点那么卫生厅长也是强调一下注册的作用
We can register anytime. It's really important that people because it's going to come much more quickly in the next couple of weeks.
所以接下来的几个礼拜我们会往年龄阶段往下走会越来越快所以我们希望那么希望你们还没有去注册的尤其是58岁以上的那么请你们赶快去注册希望你们来注册这个是最好的时候这样的话我们会让你先注册完先预约因为这个是你是已经58岁以上了因为今天现在是已经达到63岁63年以后出生的人可以预约了不是注册是预约大家一定要搞清楚先注册注册完了不一定有预约的先注册
More than 83% of people immunized
所以他也是说到了70岁以上已经有83%的老人已经注册已经打了不是注册了已经受到疫苗保护了是吧因为他们是特别容易受到这个新冠病毒的攻击所以这个还有呢就是原住民
especially local and rural health areas which are farther away from the acute care have been immunized at a greater rate than others we have 25 local health areas that have been immunized at more than 50% of the eligible population for their first dose 25 those are disproportionately in rural areas and that is for good reason and so all of that shows that the targeting that's taken place long-term care, assisted living, older population, clinically vulnerable, rural and remote communities has been affected in the vaccination campaign. And we'll be providing some detailed information next week by local health areas that we'll be able to update so you'll be able to see. And there hasn't been significant variation as between local health areas. There are the rural and remote ones, and those with a larger indigenous population that are a higher overall level. But across the system, there are only now under 30% vaccinated. Only 4 local health areas in the entire province under 30%.
那么现在呢，每个卫生局下呢，现在还没有到30%的人这个得到的疫苗保护，也就是说70%的人还没打上疫苗。
Specific strategies have been used, and I'll just talk about one finally. In Windermere last week, if you recall the chart, the local health area of Windermere or the Columbia Valley was the highest level in interior health today because of a different approach, but similar approach to what has been happening in the Fraser Health Authority. Over 50% of people in Windermere have been immunized, as is in Revelstoke, as in Prince Rupert, as of course you all know in Whistler.
Next question, Jawad Siddiqui, Connect FM.
Hi, thank you for taking my question. My question is for Dr. Bonnie Henry. So Dr. Bonnie Henry, you call these pop-up clinics innovative. So my question is, if they are effective, why not commit to improve the communications and outreach around them instead of apparently just shelving the idea for now?
Yeah, and that's what we've been talking about, and I talk with Dr. Lee and Dr. Elizabeth Brodkin in Fraser Health on a daily basis about, what were the things that worked and didn't work in those. So I'm not saying we're writing them off, but we are out of vaccine right now as well at this point in the week. So we will be looking at where are the things that worked and how did they work and how do we do better at it, and we'll be looking at that in the next little while. But hopefully, we made the point today that the best way to guarantee your spot in your vaccine is to register, and it'll be there for you. So you don't have to worry about whether there's a pop-up clinic in your community or not.
所以这个还是始终强调了，就是因为这个记者问的，就是说，有些为什么有些人不知道他要打疫苗，通知打疫苗，所以这个他始终强调的就是要请大家注册，先注册。这个 pop-up clinic 呢，也就是说是临时的搭帐篷的这种临时搭的这个。
Yeah, so the way, and that's a very good question, and thank you for that. Some of the things that I saw happen were rumors being spread on social media, and sometimes that's not helpful. I know that Fraser Health was looking at getting it out in a community on a grassroots basis, and sometimes that goes crazy. And it reminds me how we are in a very, very connected world. So, yes, we would appreciate getting the message out that these types of clinics are targeted to specific people for a reason, and your help in getting to those people would be great, particularly people who speak languages other than English. We know that sometimes that can be a challenge in finding the information they need to be comfortable being immunized, so that's one of the things that we try and do. And to give the message to others, if you don't live in Newton, don't go to the clinic in Newton. It's designed for that community. We look at our cases by where people live, and so case rates that are high in a specific community reflect people who live in that community, and that's why we try and target the clinics to make it easy for people in those communities where we know there's a lot of transmission. And we talk about in Surrey, for example, a lot of the communities are people who work in food processing or in your grocery store or healthcare workers and live in larger multi-generational families. So we need to reach out in ways that speak to those people to make sure they're comfortable and know how to access vaccines. So if you're not in that community, your community will be targeted perhaps in a different way, and there may be other ways that will reach out to you. So yes, we are trying to do things differently, trying to figure out what's the best way to reach people and provide them with the information they need to want to access vaccine and to get all their questions answered as well. And we'll continue to do that, and your help would be greatly appreciated.
Next question, Colton Davies, Radio Now.
Hi, Dr. Henry. So we keep getting surprised a little bit as media and people in the public with learning through social media that pharmacies suddenly have vaccine supply available. An example in Kamloops is that the BC Pharmacy Association website says that all the local vaccine clinics don't have AstraZeneca available. But we've seen today even that Walmart now has doses for the next 5 days. Shoppers has doses on Monday. And I'm just curious, Interior Health says that the Pharmacy Association is the middleman with doses administered at pharmacies. So does the Pharmacy Association need to better communicate this information? I just feel perhaps finding out about these clinics on social media maybe isn't ideal.
And it's another one of those challenges that we have. So right now, it's the fridge-stable AstraZeneca vaccine, and that has been available through the pharmacies. And we've partnered with the pharmacies to do that, but they have to meet certain criteria. One of the most important things that I said from the very beginning is that every single dose and every single lot number needs to be recorded in our provincial immunization registry. So not all pharmacies are connected to the immunization registry. The pharmacies that deliver our influenza vaccines are the ones that are more likely to be associated or connected to the registry, but we've needed to add additional information around these specific vaccines. So that was one of the factors that the Pharmacy Association used in determining where vaccine was going. We also wanted to make sure that we addressed those communities that were having the highest transmission risk. So there's a whole lot of factors that went into how much vaccine went where. But then once it goes out into the pharmacies, we lose a little bit of line of sight because there's a delay for when it gets entered into our immunization system. Different pharmacies have different ways of notifying people about when they have vaccine, and so it is more complicated when we deal with pharmacies. They've been doing an amazing job in getting the vaccine to people, and as you know, there's also been changing criteria about who's eligible for vaccine. What I can say around the AstraZeneca vaccine is we don't have any indication that we're going to be receiving more in the short term. And for people who've received it already, we do have guarantees that we will get some of it to be able to provide second doses for everybody who needs them. And so that's something that we're working on with the federal government, and we have confidence in. But the other sort of complicating factor is the systems that pharmacies use to be able to provide people with AstraZeneca are not always, they take some time to connect them with our provincial registration system. So if you did get your vaccine in the pharmacy and you want to you're going to be notified about your second dose, you're very likely to be notified by both the pharmacy and the provincial system. But to make it simple, just go ahead and register in the provincial system, and that just makes it simple, and you will get a notification from our provincial system as well. So, which is all to say, none of this is simple. It takes, we're talking about 600 and some pharmacies around the province. All of them have slightly different ways of doing things. And yes, some of them have vaccines still available. It may be, well, what we do know is that in areas where there wasn't as much uptake, vaccine has been transferred to pharmacies where there is more demand, and that continues to happen, but there's very little AstraZeneca left in the province right now.
Just really briefly, Colton, about 180,000 doses of AstraZeneca have been administered through pharmacies, which I think is an extraordinary achievement. There's about 10,000 left out there that has either been administered and will be reported within 24 hours, or is still to be administered. So there is a little bit of AstraZeneca out there, but essentially, as you can tell, the pharmacies around BC have done, I think, a really good job at delivering AstraZeneca around BC to
我认识的一些周围的邻居啊或者老外，他们都是打阿斯利康啊，他们的理论就是这个疫苗肯定是健康安全的，只要是疫苗我就去打啊，这种态度很好啊，都是老外。我是觉得这样的这个态度啊是能够引起足够的重视的，说这样的话我们的整个省的疫情会很快的控制，因为大家只要重视疫苗的作用啊，重视接种疫苗。
zones in this province. We also know that it's been said that the spread of variants is the main reason for these restrictions. And
他说明天会不会有路障啊，加强这个或者是路上的执勤啊，防止跨区的旅行，有没有这种措施啊？这样的话能够阻止这些，特别是这个那个变异体的传播。
in or out of Alberta legally unless Alberta and BC both.
那么同时呢，阿省和我们省的边境的跨省境的活动是不是也是非法活动？
It really is people, and we know that people are infected with the virus, and sometimes we figure out which strain of the virus they have.
那么他说，如果有人获得了这个病毒，我们也会查这个病毒是哪里来的，因为从病株上我们可以看出来哪里获来。
And that's because it turns out many of them are infected with a variant, and it's probably
那么现在看来呢，现在很多的新增案例呢都是变异体。
Everybody has it, and that's the same across the country.
那么所以我们假设呢，75%以上的变异体阳性都是变异体了。那么是的，现在我们也是担心很多人都是从阿省过来的他们也是这个带来了很多的这个变异病毒。那么有些人呢每年过来搞一些健身锻炼呢，我们是欢迎你们来，但是不是现在只能是夏天来。
For everyone listening, Dr. Henry and Minister Dix will be releasing a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. Last question, Tanya Fletcher, CBC.
大家发觉了吗？这个 CBC 的 Tanya 永远是最后一个问题，而且呢，他要用法语。
Dr. Henry, you mentioned the frontline worker vaccination program will be expanded with the next round of shipments next week. Can you specify?
那么这位记者问的就是基础工作的人，也就是工作在第一线的人，下个礼拜他们就都要开始施打疫苗了。
These pop-up clinics have not been successful because they've undermined confidence in the process. How was this not foreseen?
I can answer that one too. But, you know, I
因为他这个问题本来是想卫生厅厅长的，那么因为这个问题就是说，很多人对疫苗没有信心，特别是阿斯利康，因为用阿斯利康来部署武装这些基础工作或者是工作在第一线的救火队员呐，就那个警察，因为数里都打了，那么下个礼拜开始其他的卫生局也要打了。那么他说这个我来回答吧。
Operationally, they didn't. There was confusion, as you indicated,
他说当然很多人对疫苗有困惑、有疑问这个是很正常的。就像
On the other hand, they did raise awareness in certain communities about the need for immunization.
但是呢，现在呢，社区里边对疫苗的认知也在提高大家对疫苗的知识水平也在越来越清楚，所以。
Important question to me.
Oh, it was just about specifying which frontline workers
请他再指定一下，谁下个礼拜哪一类的人就是前线工作人员先打。那么他说我们现在因为还是用阿斯利康来武装他们，所以因为主要是因为疫苗的有限，数量有限。
And that is first responders, so police and fire services,
主要是这个
childcare staff,
孩子们的。 教职员工以及这个救火队员先让他们打。
knowing the amount of vaccine that we have, so a good proportion of
因为这些人是一个符合我们的这个比例符合我们现在有的库存的情况。
For example, in those three categories, and moved around the province. As we have more vaccine coming in, 15%,
随着疫苗的来了越来越多的话呢，
to have those groups
我们还有其他的行业的这个一线工作人员来打。
That's the goal.
这个也是我们的计划，是5月中旬全部给这个第一线工作人员防护起来。
Looking at that right now in the outbreak that's happening in Site C in a number of different places around the Lower Mainland, and we will continue that program as well. That's a much smaller proportion of vaccine, and as the Johnson & Johnson vaccine
那么现在强生疫苗下礼拜开始来了。
Others on that list that we came up with.
那么同时呢，我们现在这个第一线工作人员也要部署给他们。
End of March, hoping that we would have more vaccine available in April.
这个也是我们很乐观的，也是说
cross-border truckers and others.
特别是那些跨省的这些司机啊，整卡车司机啊等等包括还有其他的我们在名单上的这些前线工作人员，也是要让他们同时我再强调一下我们省的这个疫苗政策还是绝大多数还是以这个年龄为基础打。特别是但是呢，你说这些这个grocery store 啊，这个
get your vaccine through the age process. That's the most efficient way to do it, and we will try and
尤其是你比如说你在商店里边啊，或者是你在这个物流工作的只要你到年龄，请你马上来打这也是我们的重点之一。因为他们主要还是让第一线工作人员以及这个食物加工厂这些叫 essential worker 有些不是 essential worker 呢，就是你如果还是在这些什么零售店啊，或者是物流中心啊、物流场所啊，那你只要到年龄，请你马上去打
83% of people over 70.
那么他说83%的70岁以上的人已经接种疫苗了特别是第一针很重要的这个是整个 BC 省
188,000 people clinically vulnerable. Most of them
那么还有呢就是180就是108000人这些人呢是这个是诊所认为是额外需要打的，他们有证明的，让他们也打了，这一步目标都完成了。
The work that's been done with the First Nations Health Authority.
那么现在呢，那个原住民的这些管理局社区呢，也是完成了疫苗的接种。那么同时呢，我们也是对长期护理院的员工以及都已经开始打了。因为我也听到了太多的这个长期护理院的员工他们这个获得阳性的占的比例也很高。所以每个人都很自信我们也都很自信心的看到那么多人的接种
In Dawson Creek a week ago, we had high levels of transmission.
那么他也说到了 Dawson Creek 是一个社区
that has changed because of innovative
接种了以后呢，这个社区的疫苗的接种疫苗以后，社区的传播急剧下降同时呢，像低陆平原的这个社区也是尤其是这个北部的Prince Rupert 这个城市自从全体居民免疫以后这个几乎就没有人再传染了。
And what I'm asking people today is, given the success of the age-based program, of the clinically vulnerable program, to please register. The more people that register, if you register, you're going to get your chance to be vaccinated. And that's what we need to do today. So my core message is register, register, register. And we're going to continue, and I know everyone involved in the immunization campaign is going to do everything they can.
所以这个我们现在的这个口号就是每一个人都要来打疫苗。
Tanya, did you have a follow-up?
Yes, thanks. And an answer in French from Minister Dix would be appreciated. Thank you. Can you please clarify why the system to notify people in hotspot areas about the pop-up clinics doesn't appear to be working? The overwhelming majority of people who actually live in those communities that we're hearing from were not told about these clinics, even though they had all registered online prior. So were emails sent? Was it text messages, phone calls? Can you say how many people residing in those areas were actually notified?
看到更多的人来注册来预约那么你有哪些方法没有足够的方法有效的方法通知他到达每一个需要打的人你们有什么这个不同的方法有没有检讨过
very quickly on social media from certain people and that happens and it is
the challenges in a large urban area like that which are different from smaller less populated areas so I know that they are regrouping and looking at what worked and what didn't work. I know next week we are looking at some of the open virus, for example, and there will be continued
to be different ways to outreach to different communities. And I think the
所以
really
他说我
important
们也
thing
会
that
强
you
调的，继续
mentioned
的
is,
在不同的
you know,
社区
people
来这个特别重要的
the
是
registration
希
is
望大
the
家
way
能
that
够
you
来
will
注册
get a
问题就
guaranteed
在这儿
vaccine in
不是
your
所有的
clinic.
人在注册
And
没有
we
注
need
册
to
的
find
人
ways
真的
to
就
answer
很难
people's
接到
questions.
这个信息
And that
所
was
以
one
这
of
个
the
的确
discussions
是
that
有
we've had
有
in
问题
several
这个
different
的确是有问
communities
题
where there's a
这个
lower
记者
rate
问得
of
很好就
registration.
是你没有去注册的
What
你
is that?
我
Is
也
it
没有这
because
个在
people
这个
don't know how the system
本地的
works,
药房注册
don't
过
know where to go to do
那么
that,
怎
or
么
is
知
it
道
because they have
比如
questions and
说
they're not ready
我邻
yet
居
to commit
老人
to being part
他
of
没有
the
注册
immunization program?
那他
And
是热
that's
点地
something
区
that I'm
那
going
他
to
怎
be
么办
looking at
他
and
没有收
working
到任何
with
信息要他打
colleagues
去打
across
疫
the
苗
province
的
to
确是
make sure
所以
we're
这
doing
个
it
也
in
是
the
对
right
他们提
language
出一
and
个
the
挑
right
战
tone, answering the right questions, and doing better at that to encourage people to get into that stream of getting immunized as quickly as we can. So there's still many things to learn as we go through this, and It's Our Shot is one of the programs that is designed to reach out to different communities, and we want to be part of that as well. Looking at, how do we engage with people who know their community a little better to find out what the barriers are and remove those barriers. And so there will be more experiments as we go through this, and as more vaccines available, and we get it to more and more people across the province. And can I just say before I turn it over to Minister Dix, I forgot to mention as well that our Speak survey is out there still. We've had about 150,000 people who have answered it so
已经有115万的人完成了我们的这个民意调查。这个民意调查呢，我做过了，基本上还是偏重心理上，对我们这次新冠疫情对我们的生活造成的冲击的调查。他们主要是调查心理上，你有这个经济上倒没有什么问，是有点烦，这个问题问的是有点烦。如果大家愿意贡献分享自己的这个经历那么鼓励大家还是到 Bc CDC 网站去找到这个民意调查的链接做一下我本人做了，可能是10分钟到15分钟，问的问题呢的确是事无巨细的，是有点繁琐但是所以他说第一次民意调查有40万人以上到目前第二次呢民意调查已经有15万的人已经完成这个民意调查了，也是感谢大家。那么我也回到刚才的问题，那么24小时不到，他说大多数的数据呢已经出来了，新增了874例，那到了128763人，现在 BC 省累计，那其中呢盐卫生局新增的是187例。飞沙卫生局新增是574例，岛上卫生局新增29例，内陆卫生局新增是60例，北部卫生局新增了是24例，没有这个旅行上的获得，国际上的旅行获得的。那么同时呢，因为数据没有完整性，所以到目前为止有多少个active case 没有，有多少个监视居住没有，但是呢住院有503个人。我看了看4月22号上周四给大家做直播的时候呢是502个。重症监护是161个，今天呢是过了1个礼拜是503个，重症监护是170个。礼拜一呢是484个，重症监护是158个。那看来还是有反复那么死亡呢是1例，现在呢累计呢是1577例，到目前为止呢已经有1749375个 BC 省人接受了疫苗注射，其中呢超过9万的人呢已经完成了这个第2针的疫苗的注射。好，那么今天呢各位网友各位观众，今天的新冠疫情 BC 省新冠疫情的新闻简报呢就给大家做到这儿。他说我们下星期一再会了，那也祝各位网友安全，同时呢周末愉快。